The first trigger is there, which is about a third of the way along the length of the supraspinatus before it hits the acromion. The second is here, and these two are where the muscle bulk, especially this one, is where the muscle bulk is most. Okay. And the third point is the insertion of the tendon into the bone, which is called the enthesis. So the two triggers of the supraspinatus will refer pain out into the lateral part of the upper arm, and this pain will kind of dribble down. So lateral anterior area running down, which is the common place that people do. They put their hand over the top of like this. They wrap their fingers around and they say, ouch. You have a number of choices as to how you treat the triggers in the supraspinatus. The muscle is very easy to get to. So the first and the most common way would be to use ischemic pressure. And what I'm going to do is we'll start with this trigger here. So the muscle bulk is thinner here. I put my finger or I put my thumb onto the trigger. I feel for it. I find the trigger by running across the long axis of the muscle, and I move backwards and forwards and feeling for a thickening which is sitting in a long, in a tight band of muscle. Once I find that, I'm looking at my patient's face and I say, you know, can you feel that? And he would say, if he had a trigger, yes, yes I do. And then I can support my hand, my thumb, with my other hand or with my other thumb. Yeah? My other thumb is pressing onto the trigger itself, and I look at my patient and I say, watching your face, and I say, is that sore? If he says yes, then what I do is I reduce the pressure. Does that feel comfortable? He just nods. Yeah. Yeah, cool. Okay. And at this point, I ask my patient to just gently breathe and relax. And as he does that, I gradually increase the pressure on the trigger point itself. And I ask you, please tell me if it starts to hurt. And so as I press down, gradually the pressure increases and increases. Is that painful?
It's fine.
Good. Until I feel that I'm pushing really almost as hard as I can. And if I was to come back in here and move backwards and forwards, that little tight area, the trigger point itself, will actually be gone, and this will be completely painless. So that is using ischemic pressure on this trigger to switch it off.